This is Dr. Andrew Jones. In this edition of Veterinary Secrets, I'm going to be discussing lipomas, how to know if your dog has one, and what you can do about it. In today's video we have Pearl. Pearl was Lewis's biggest buddy. Why I'm featuring Pearl today is she has a specific type of growth called a lipoma or a fatty tumor. They're very common in dogs, especially our dogs that are sort of middle-aged, slightly overweight. We're one of the most common tumors, and they're benign, so they're really more of a growth that we would see in veterinary practice. The big point of doing today's video is, one, I can show you actually Pearl's got a substantial lipoma, so I'm going to show you what it is, how you can get a better sense if your dog has one. We're going to take a little sample of it so you can see what it looks like. And then I'm going to discuss some of the home remedies that you could consider using that may help essentially treat or get rid of that lipoma at home. So you guys, I got the camera in close now so we can actually see Pearl's lipoma. So she has this large mass just along the front of her chest wall. So I'm going to show it to you here, and then we'll discuss some of the characteristics of it. And then you'll get a better sense of what is a lipoma and how to know if your own dog has one. Oh, Pearl. So here it is here, you guys. I'm going to lie her on her side. So I've got it in my hand. She's got this big mass just lying here from sort of under her collar all along this front part, below her neck, all the way right down to her chest. The big thing about lipomas, some of the characteristics to determine is it serious or not, is one, is it soft? So Pearl's mass, that mass is quite soft. Is it movable? I can grab Pearl's mass, move it around really easily, so it's very movable. Soft, it's movable. It's been there for a number of years, so it's considered slow growing. Those are all signs of something that is not serious. That's just a benign growth, as opposed to something cancerous. So it's soft, it's movable, it's relatively slow growing. It's not firmly attached to anything. It's loose just under the skin. It's not firmly attached at all to anything underneath the skin. As I can feel it here. It's not painful in any way. It doesn't really seem to hinder Pearl in any way. It's more in something we're looking at it thinking, oh, what is this big growth? And Pearl is, she's on the older, she's over 14. As she's gotten less active, she's definitely put on a few extra pounds, so she'd be considered overweight. So she's got all the signs and symptoms of what you expect to have a dog who has a lipoma, and that's what Pearl has there. The specific diagnosis of any lump actually comes from an aspirate or a biopsy sample sent to a lab. But generally, if you've got a dog that has a growth, such as Pearl's, it's soft, it's movable, it's just under the skin, relatively slow growing, more than likely your dog has a lipoma. And these are benign fatty growths that you can just leave alone, that aren't going to need surgery. In many cases, you want to know for sure, you're not 100% convinced, so that would mean visiting your veterinarian. And that way, what they would do is a thing called a fine needle aspirate. And in most cases, that can give you a diagnosis of exactly what it is. So what that means is, they've got something like this needle, this syringe, and all they would need to do, like we're going to do here in Pearl, is just put some type of antiseptic on top of that. I've just got alcohol here. Give it a little bit of a swab. What you're going to do here with Pearl, just over this fur here, we're just going to make it a little bit cleaner, a little more sterile. Pearl. And then it's just a matter of, we're going to put this 22 gauge needle and syringe in there. Let's get a little sample of that. So then what I would do is just put it on a microscope slide. We don't have that here, but I have a lid. And what I'm going to do is we're just going to expel whatever came out of that syringe on the lid. And I don't know if you'll be able to see it. but on top is just a real, it looks like fat. So it's just a whitish, clearish tissue, which is what I would expect to see in a dog that had a lipoma. In practice then, that would go on a slide. We would just smear it, so you'd spread it across the slide, and then you'd stain it and have a look under the microscope. And in that way, most clinics can then tell for sure, give the confirmatory diagnoses of a lipoma or the benign fatty growth. So assuming your dog has a fatty tumor, this lipoma, what should you do? What are kind of the first big steps? Say you're not wanting to have surgery, which most of you shouldn't be needing. Well, my first big suggestion is this. Feed your dog less of this. So it's like, less kibble, which in majority of cases is primarily a carbohydrate with some protein. And feed your dog more protein, more than anything else, where perhaps that means some food you're making at home, some of the better quality, even if it's going to be some kibble, consider even some of the raw food. But the big thing is we need to eliminate those carbohydrates as much as possible, which are then causing these glycemic spikes, and then in my opinion more likely to produce a pet which is overweight, much the same way which is having the effect on our metabolism and with people. And that alone, so if we can decrease the body fat on your dog, then we're much more likely to decrease the size of that lipoma, and ultimately shrink it without having surgery, and decrease the likelihood of your dog having more lipomas. Some of the other suggestions, consider vitamin E. So this is vitamin E here, it's 400 IUs. We're looking at a pretty typical pet dose of 100 IUs per 10 pounds of body weight daily. So something like Pearl, she would need 2 of these tablets daily. It's considered one specific vitamin, which is much of an immune stimulant, specifically for the skin and for lumps that are growing on the skin. So that the other thought with seeing lipomas as our dogs age is that their immune system is becoming less active. So if we can stimulate that immune system, such as with vitamin E, get the skin immune system more active, potentially we can help treat that lipoma at home and decrease the likelihood of more of those from coming back. The next thing I want you to consider is this. It's tea, not just any tea, but green tea. So this is the green tea that I drink at home here. So it's the green tea leaves. And some of the thought is that green tea is one of the specific teas that can potentially boost metabolism. It's been seen in people and in some animals as far as a slight boost in metabolic rate. So I thought if we can do that, then we can potentially look at increasing your dog's metabolism, once again decreasing their body fat, shrinking those lipomas. So an easy way to do it would be just making a cup of green tea, or with either you can have the green tea bags, or if I'm making it from the dried leaves, I would just put a half a teaspoon for a cup of a green tea, and just substitute that in your dog's water as opposed to having him drink water. Substitute with green tea. First of all, it's got a whole number of specific benefits. It's super strong in antioxidants. It's got some other specific medicinal properties, and it may help boost your dog's metabolism. So just substitute green tea as opposed to their water. Try that for 6 to 8 weeks. You may be surprised to see them lose weight and shrink that lipoma. I want you guys to consider adding some of these to your dog's diet. This happens to be yogurt. What's in yogurt is the good bacteria or probiotics. In particular, this would be one which is high in lactobacillus. It's probably the most important probiotic to look at adding. Because what we want to try to do is priming your dog's immune system, get it to be potentially more active to help prevent these fatty tumors from growing in the first place. And secondly, seeing if we can prime that immune system, having it actually deal with shrinking that fatty growth. It's just a good health thing to do, period, for your dog. Secondly, it may help actually shrink that growth. If you're wondering sort of as doses, typically when we're looking at probiotics in a capsule, we're looking at 100 CFUs. It's 100 million CFUs, or colony forming units, per 10 pounds of body weight daily. Another thing I really think you should be thinking about adding is this one herb in particular. You've heard me discuss it many times. I just did a recent video on it, but it's actually curcumin. So here it is here, the 95% curcuminoids. We're looking at doses for dogs of 100 milligrams per 10 pounds of body weight daily. The big thing with curcumin, and if I've got a dog who's got, especially an enlarging fatty tumor, it'd be one of the first things I'd have you think about is adding in the curcumin, because we know it's got specific anti-inflammatory properties. We also know that it's specifically effective for helping, prime your dog's immune system to help fight certain growths, because they're actually using curcumin for dogs that have cancer. So if you've got this enlarging fatty tumor and you're sort of concerned, like, what else could I give my dog? One of the first things that, if I'm going to get you to give a supplement, which I think has a reasonable chance of working, would be curcumin. But it needs to be the 95% curcuminoids, and it needs to be the adequate dose, 100 milligrams per 10 pounds of body weight daily. The last thing I want to discuss is the use of colostrum. So bovine colostrum in particular has a number of different therapeutic properties and benefits for our dogs. Again, gastrointestinal and protecting against anti-inflammatory damage, specifically aiding and supporting the immune system, especially in certain diseases, such as the flus. But also the thought is that colostrum can do a couple of things. One, it's being used in athletes to help boost their metabolism. Secondly, too, it's helping keeping them healthy longer, decreasing the likelihood of certain diseases. So it could have a couple different benefits if we were trying to deal with a dog who's got a fatty tumor such as Pearl. One, boost their metabolism. Secondly, primary immune system to help sort of try to fight or shrink that growth and preventing other ones from happening. When we're looking at colostrum doses, we're looking at about 100 milligrams. So we're looking about, for something like Pearl, she needs about 1 gram once or twice daily. The higher end of the dose would be twice a day. So that's about 100 milligrams per 10 pounds of body weight daily. The colostrum is in my supplement. This is Ultimate Canine Health Formula. Also within my supplement are the probiotics as well. But when you're looking at, there's a number of different types of supplements. It doesn't need to be my supplement. You can just get specific colostrum supplement. But once again, just look at, and just make sure you're looking at the adequate doses of, as I said earlier, about 100 milligrams per 10 pounds of body weight daily. Thank you for watching this edition of Veterinary Secrets on Lipomas. What I want you to do now is first click that below to like this video, click that link above there to subscribe to my channel, and then I want you to go ahead, click that link right in the box below, and you can sign up for my newsletter and get my free books and videos on how to heal your pets at home with my top natural remedies.